cow. So a 3-month-old infant is suffering from the acute segmental pneumonia, has dyspnea, and the respiratory rate is given, that is 80 per minute. There is a paradoxical breathing, there is a tachycardia, there is a total cyanosis. Respiration and pulse ratio is 1:2. The heart dullness under the normal size, such sign characteristics. See, in these questions, we have something related to what? We have something related to the patients having the dyspnea and the respiratory rate is given. So, based on that, we will classify the patients or based on the respiratory rate, based on the cyanosis. Okay, on that conditions, we studied that there is a condition that respiratory failure. So, we will see that there is a 3-month-old infant suffering from acute segmental pneumonia. The patient having the dyspnea. What is the dyspnea? There is a decrease in what? Or dyspnea, it can be the increase in respiratory rate, it can be the decrease in respiratory rate. So what happens in the dyspnea? There is a abnormal respirations. You can remember it like that. There is a abnormal respirations will be there. There is abnormal respirations is there. Then paradoxical breathing, there is a tachycardia, total cyanosis. What is the total? What is there? Total cyanosis is there. Respiration and pulse ratio is 1:2. The heart dullness under the normal size, such sign characteristics. So they are asking one thing I told that you need to understand the last. You need to read the first line first. Last line first. Such sign characteristics. So we can see the respiratory failure of the 3rd degree, 1 degree, myocardial congenital. Maybe the question from the respiratory failure, maybe the question from the myocarditis, maybe question from the congenital heart malformation, maybe the question from the respiratory failure of the 3rd degree. One more trick to solve the questions. If you are seeing, if you don't know anything, in the questions, see, there will be the multiple choice question of the same, like the usual, like here the respiratory failure of the 1 degree, respiratory failure 2nd degree, respiratory failure of the 3rd degree. Most probably 98 to 99% answer will be from these options only. Answer will be from these options only. In the main exams, main exams you mainly got the 4 options, and so this option will be not there. So you will see there will be the 4 options. So 4 options out of the 2 options can be the answer. So that is a trick when you don't know anything. This is again a right tricks. Write there anything in the blank in the bracket or anything. So here we are talking. It can be the myocarditis. Are you thinking that there is a problem with the respirations and there is nothing mentioned about the myocarditis and there is a pneumonia is mentioned? If there is a mentioning of the corynebacterium diphtheria or the Coxsackie virus, if there is a Coxsackie virus or there can be the corynebacterium diphtheria, so this can cause the myocarditis, but here is nothing is mentioning about, that's why it's not the answer. Congenital heart malformation, there is a 3-month-old infant. Of course, it is not congenital, so that's why it will not be the answer. The answer will be from the 3 options. So let's see what is the 3 options. Okay, let me write it here. So the PDF will becomes 22 Feb. See, we have the, let's talk about the, let me write it here, 22 Feb. Let's talk about the respiratory failure. The respiratory failure. Question number, what is the question number? 13. So the respiratory failure, remember, in the respiratory failure, we have the, see, there is 2 conditions. We can have the 1 and the second conditions. Like in the first conditions, what we will be having, if there is a no perfusion, or there will be the hypoxia condition. Hypoxia means less oxygen will be there. But the second conditions about the respiratory failure, the conditions can be the no ventilations. There is a no ventilations. See, ventilations, it occur at the alveoli levels. And the perfusion, it occur at the bronchus levels. When we are inspiring and expiring, so at that level we see the perfusions. But ventilations, it occur at the alveoli regions. So there will be the hypercapnia. So these 2 conditions might be possible. What is the normal respiratory rate? What is the normal respiratory rate? So the normal respiratory rate, remember, it will be equal to 50 to 60. You need to remember this. The normal respiratory rate, this is the normal respiratory rate of a baby, that is 50 to 60. 50 to 60 respiratory rate. Now the respiratory failure, they classified into three types. See, first, second, and third. The first conditions, we call this condition as the that is mild dyspnea. If they are in the first respiratory failure, what we will see there is a mild dyspnea. And what about the respiratory rate in this condition? The respiratory rate will be the 60 to 70. See, there is no such much difference in the respiration rate, and there will be no cyanosis. What is the cyanosis? Cyanosis means normally what we see like the term cyanosis. See, the cyanosis will be there. So there is a no cyanosis means bluish coloration of the skin. Why the bluish coloration of the skin? Due to hypoxia. The bluish coloration of the skin, bluish color of skin, that is due to hypoxia. That will be due to hypoxia. Okay, so here in this respiratory rate failure one, there is a no cyanosis. So this should be our, is that can be the answer? No. In the questions we have the severe cyanosis. So the second option says that we will having the moderate dyspnea. The second respiratory failure, in the second respiratory failure, what we will see? We see there is a moderate dyspnea. So here we can see there is a 70 to 80 respiratory rate. What we will see? 70 to 80 respiratory rate, and the patients will having the acrocyanosis. Means that there is a you can say this is the moderate cyanosis. There is some amount of oxygen is present, but there is a deficiency of oxygen, due to which there is a acrocyanosis. Means some part of the body is bluish and some part of the body is normal. Then third point, you can remember it as that we will having the, see, that is the severe dyspnea. If the patient is having undergo the severe dyspnea, or there is any severe abnormal change in the respirations, then that conditions we are having the 80 to 100 respiratory rate. And the patient having the severe pneumonia, the patient will be having severe pneumonia conditions. And in the severe pneumonia, remember that if there is a severe pneumonia will be there, so that conditions we will see there is a complete cyanosis. What we will see? Complete cyanosis will be there. The complete cyanosis will be there. So if the severe dyspnea is there, so what will be the respiratory rate? We are seeing 80 to 100, and the patients will be having the severe pneumonia, and they will see there is a complete cyanosis conditions will be there. These first and the second failure we can manage with the help of like normally supportive treatment. We can treat them as home as well, but for these conditions this is the treatment. This is what treatment. But for the third respiratory failure, we need to go for ICU. And this patient having the severe pneumonia. So I told you already these conditions before as well. What we discussed yesterday, or I think before that. Yeah, I think yesterday we discussed these things. See, if there is a no pneumonia, we have the fever, cough and cold. So there is a oral paracetamol. If wheezing is there, we need to do salbutamol for 5 days. But if pneumonia is there, we need to have the fever, cough, cold, fast breathing and chest indrawing will be there. There will be the no hypoxia. If there is a no hypoxia, we can give the oral paracetamol, salbutamol, because patient is wheezing. Along with that, we need to treat the patient with the oral antibiotic because the pneumonia is there. Now, in case of complete cyanosis, there is a severe pneumonia or very severe conditions is there. So, hypoxia will be 100%. There is a stridor and the danger signs can be there. So, we need to give this patient as the ampicillin, oxacillin plus gentamicins. So, this is what? This is the pediatric pneumonia drug of the choice for the pediatric pneumonia. This is the drug of choice for pediatric pneumonia. So, this yesterday we discussed. So, in the severe pneumonia, these conditions, firstly we need to give the, that's why somebody asked in the yesterday class as well, what he asked that why we are giving ampicillin, oxacillin, whether it will be the viral infections or anything. So, we are giving here the first line treatment and we will send this patient to the ICU because of the severe cyanosis and severe hypoxia conditions. So, in this patient again we will give the pediatric pneumonia solutions. So, the pediatric pneumonia, the drug of the choice, what was that? oxacillin. The oxacillin or the ampicillin. The oxacillin or the ampicillin are also along with that aminoglycosides. And aminoglycosides, I told you that there can be the gentamicin, there can be the gentamicins, there can be the amikacin. Every one of you, please, whenever we are studying, see, we will study the lots of drugs. I want everyone, like where you are writing or your notebook, on the last page of your 2 or 3 pages, last page of 2 or 3 pages, just write all the drugs, so that you can easily recall everything later on. So revise, write everything on the last page or the last 2 to 3 pages. Write every drugs whatever we are studying. It's like pediatric pneumonia. In between we will study about the pediatrics in case of meningitis. So all those drugs it should be on your last page. Okay. So aminoglycosides and oxacillins we will give in case of ICU patients. So now we can see the question. Yes. So see. We having the 3-month-old. We have the 3-month-old infant suffering from acute segmental pneumonia and dyspnea. The respiratory rate is given 80 per minute. Okay. Paradoxical breathing, tachycardia is there. Total cyanosis. So the total cyanosis and the respiration and the pulse ratio is 1:2. That you just remember. The heart dullness under the normal size. So heart is normal, because that's why it cannot be the answer. It cannot be the answer. The such sign characteristics means it can be the 1 degree, 3rd degree, or the 2nd degree. So we have the total cyanosis. It means the patient is under the respiratory failure of the 3rd degree. I hope this is clear. So, okay. I hope this is clear. Then the next is what? The 7-month-old infant is suffering from the acute pneumonia, which was complicated by the cardiovascular. See, yesterday we studied this condition, acute pneumonia is there, which was complicated by the cardiovascular insufficiency and the respiratory failure of the 2nd degree. The accompanying diagnosis is the malnutrition. The second, choose the best variant of the therapy. The same conditions we are giving. Again, repeating these things. If the pneumonia is given, what we are giving? Oral paracetamol, salbutamol, oral antibiotics. If the severe pneumonia, there is ampicillin, oxacillin plus gentamicin or the aminoglycosides. See, here we are talking about the pediatric pneumonia. And in these questions, we are talking about the acute pneumonia and there is a respiratory failure of the 2nd degree. Now see the options. Are you getting the options? This patient is having the acute pneumonia, but the patient is having the respiratory failure of the 2nd degree. There are also some complications we can see that the accompanying diagnosis is malnutrition of the 2nd degree, and along with that we have the cardiovascular insufficiencies there. So can you see there is a Ampiox and penicillin? I hope you can mark this also. So don't do this type of the silly mistakes. If Ampiox, see Ampiox and polymyxin, gentamicin and macropin. So read question options carefully. What we need to give? Oxacillin, that is Ampiox, and what other things we can give? Amikacin, that is aminoglycosides, and or other than that we can give the gentamicin. Okay. I hope this is clear. Yesterday we discussed this. Now let's talk about the other important topic, that is we have. Okay, before going to that, let's discuss some drugs in details. See here, come here. So we have studied that there is a penicillin. We already know about, everyone knows about the penicillin. So we have the drugs, that is penicillin G. Penicillin G. And this was the oldest drug. This was the oldest drugs, but it has some drawback. What drawback it have? That it is not effective orally. It is not effective orally. It is not effective orally. Then what we did? We make the drugs that becomes the effective orally. So what was that drugs? That is the oral penicillin. What we take the orally? We take the orally vodka. What we take the orally? Vodka. I'm not writing everything, just I'm writing in the You need to write. If you want to write, you can write. There is a varincillin, there is a oxacillin, there is a dicloxacillin, there is a cloxacillin, there is a cloxacillin, there is a ampicillin. Okay, repeating it again. There is a penicillin. Sorry, this is a V penicillin. This is penicillin V. So we discovered the drugs, that is penicillin V, oxacillin, then we have the dicloxacillin, then we have the cloxacillin, and we have the drugs, that is ampicillin. When we combine these drugs with probenecid, when we combine these drugs probenecid, it becomes the that is become the long acting drugs. Just a second. Then we have the drugs, that is the long acting. Then this it becomes when we have the, like when we combine the drugs like penicillin G, penicillin V, oxacillin, dicloxacillin, cloxacillin along with the probenecid, so it becomes the long acting drugs. That you also need to understand. After that, what we make, this we already discussed in the Krok one time. Okay, so you already studied these things. So just you need to recall these things what I am teaching. Then we have the extended spectrum antibiotics. What was the like extended spectrum antibiotic that was more effective against the Pseudomonas? Okay, in the Pseudomonas you need to remember that is the piperacillin. That was the drugs piperacillin, and the piperacillin along with the tazobactam, So this was the drugs, like these were the drugs good for the Pseudomonas. Sorry, the drug was good for the Pseudomonas. These are the drugs that is good, was good for the Pseudomonas. Then we some bacteria, they were so notorious. So what they did, they make the resistant property, because they have what? They have the plasmid. What they have? They have the plasmid, and because of this plasmid, every bacteria they got resistance. Keep recalling everything from your Krok 1 point of view or whatever you are studying till now. Then we are also smart. What we make? We make the penicillinase or beta-lactamase resistance and penicillin. Okay. Then what was these drugs? These was the condom drugs. What was the condom drugs? That you need to remember. Cloxacillin, oxacillin. What was the oxacillin? Another name? Ampiox. Remember for the Kroks, Ampiox. Then N4 we have the nafcillin. N4 what we have? Nafcillin. D4 remember we have the dicloxacillin. D4 we have the dicloxacillin. O4 again oxacillin. M4 remember methicillin. Here is the point. See, many of the bacteria they are methicillin resistant. So in that conditions, what we need to do, they are the we call this these bacteria MRSA. What are these? Methicillin resistant Staph aureus. So if these resistance, we give the methicillin. But if methicillin is resistance or the methicillin resistant Staph aureus bacteria, so it means if any bacteria that is resistant to the methicillin, it means that they are resistant to all beta lactams. So in that conditions, which drugs we will give? We will give the patients which drugs? That is, drug of the choice is for this condition is the vancomycin. But if vancomycin is also resistant, if vancomycin resistant Staph aureus bacteria Varsa, if Varsa is there, then what we need to give? What we need to give? We have to give the drug of the choice for this condition is linezolid. What we need to give? Linezolid. I hope this is clear. See, if we have any bacteria that is resistant to methicillin, we need to give the resistant drug of the choice for that condition is vancomycin. If vancomycin resistant Staph aureus, the drug of the choice for that condition is the linezolid. I hope this is clear. Okay. And the best bacterial drugs, always remember this drug, that is ampicillin, or best antibacterial, that we ampicillin plus sulbactam, ampicillin, amoxicillin plus clavulanic acids. And one drugs we just studied, that is piperacillin plus tazobactam. So these are the most useful and the most potent antibiotic, or the most potent drugs with the penicillins. Okay, then you can also remember the lots of questions will be from here. So the uses of penicillin. So remember, the uses of penicillin is last man. Uses of penicillin is the last man. The last man. So remember this, if we have the L4, we have the listeria. L4, we have the listeria. A4, what we have, that is the actinomyces. A4, what we have, actinomyces. S4, they are used in syphilis. So always remember, for the syphilis, we have the drug of the choice is benzathine penicillin. We have the drug of the choice is benzathine penicillin. Okay. Then T4 they can use for the tetanus as well. Tetanus. M4 they can remember. You can remember it as the meningococcus. And AN4, remember, we have the anthrax. So all these conditions, what we can use? We can use the penicillins. The last man, we have the listeria, we have the actinomyces, we have the syphilis, we have the tetanus, we have the meningococcus, we have the anthrax. For all these conditions, what we have to do? We have to use the penicillins. And the drug of the choice for the syphilis, you can remember, that is the benzathine penicillin. That is the benzathine penicillin. This you need to remember. For Pseudomonas, you need to remember that there is a piperacillin plus tazobactams. That is the piperacillin plus tazobactams. Okay. If any bacteria that is resistant to the beta lactams, we can give the meropenem, carbapenims, that we will study later, based on that. Then we have the methicillins. There is a methicillin resistant Staph aureus, so that is we will give the vancomycin. If VRSA, yani ki vancomycin resistant Staph aureus, the drug of the choice for that condition is the linezolid. But if any bacteria that is methicillin sensitive to the Staph aureus, so in that conditions we give the we can give the naphicillin or the dicloxacillin. So these drugs we can use if the methicillin sensitive. Okay, if any bacteria that is methicillin sensitive, we can use any of these type of the drugs. But if it's methicillin resistance, it means it's resistance to all the beta lactams. So in that condition, we need to give the vancomycin, and then we have the linezolid. I hope this is clear. Now let's discuss about the cephalosporin as well, I think. See, cephalosporin, this is like the important drugs, but it have the classification is big for the cephalosporin, but I will make it simple. The cephalosporin, remember, so see, in the cephalosporin, when we are talking about, so we have the five or four, we have the 5 generations: first, second, third, fourth, and fifth. So you need to remember just what you need to remember, the whatever the keywords for all these type of the drugs. So see, in case of the first generation, like we have the cefazolin, So you need to remember that we have the A here, or let me write it some more. So we have the cefalexin, we have the cefalexin, we have the cefadroxil, cefalexin, cefadroxil, we have the cephaloridins. Then just remember these things. Then remember we have the cefa. So cefa. So if A is coming, A means first. So these are the first generations. In second one, remember that in second generations we have the C-chlor, cefaclor. I will tell you. Then remember that if me is given, or you need to remember the third one before. Okay, just third one, because in the second there is a many. See, in the third one you need to remember there is a saffitixim. Me is there. Then we have the sapodoxim. Then you need to remember there can be the triaxone. Triaxone. We have to triaxones. We can have the saftibutene. So this you need to remember. See, now here you can see that we have the me 1 or 10, me 110, and one more drug, me 110. Then we have the one more drugs you can remember, that is moxalactam. Okay. Then fourth generation, remember in the fourth generation we have the safipime. Then we have the safipyrome. Then we have, so remember these conditions. If you have the safipyrome, so pi plus me is there. Okay, pi plus me is there, so that means that is the fourth generation. Pi plus me, that is what? Fourth generation. In the fifth generation, remember these fifth generation, they are effective against the MRSA. Effective against, what is MRSA? Methicillin resistant Staph aureus. And what are these drugs? They are the ceftibiprole, and we have the ceftaroline. Now I will tell you what you need to remember, what you don't need to remember, and it will become very, very, very easy. So if you are getting the roll, you have to roll. So roll the fifth one. Pi plus me, pi me 4, pi me 4. Okay. Then you need a third, we have the me 110. Then remember the second one. Other drugs, whatever you are remember, that remember for the second drug. Okay. Just I am writing the exception, all the exception here. Then what are the exceptions you need to remember? These are the exceptions. See, the exceptions we have, that is cefuroxime. What is that drugs? That should be the me. So me comes in third generations, but it is what? It is the second generations. Okay. Then we have the cefaclor. So A should comes in the first generation, but it is the second generation. There is one more drug that is doesn't comes in our like mnemonics or the tricks, that is moxalactam, and the moxalactam we know that is the third generation. I know that you will remember these drugs. Okay. So I hope this is clear. If you are getting the cefazolin, see A is there. So A is there means we have the first generations. If we are getting the cefaclor, this you need to remember this one only. This one remember. And for the cefaclor and cefuroxime, and cefuroxime, or other drugs, whatever the drugs we have, that will come into the this second generation. Okay, so the first generation A will be there. The first generation you need to remember the A. चलती क्या 9 से 12. Then second you need to remember we have the second is controversial. Second controversial. So second you don't need to remember. No remember. Don't remember. Just remember cefaclor and cefuroxime. Third generation there is a me plus me, or there is a thing 1 if, and there is a 10. So me 110, me 110, me 110. Just speak with me. Me 110, me 110, me 110, me 110, me 110, me 110. Okay. Then fourth generation, remember we have the pi plus me, pi me, pi me, pi me, pi me, pi me. They are the fourth generation. And fifth generation, they are the roll me 5 times. Roll me how many times? 5 times. So roll will come in the fifth generation, and all your cephalosporin has been covered. Okay. So these things you need to remember very, very importantly. If you like, it will help you in the future as well, and not so much in the Krok 2 exams. One things can be asked in the Krok 2 exam, that is effective against the MRSA. But this was important, so I told you. Okay, so they are effective against the MRSA. Okay, along with that, what you need to remember for the Krok 2. So see, for Krok 2 they can ask you for the Pseudomonas. They can ask you for the gram-negative bacteria. See, the drugs like cefepime, the cefepime, cefepirome, like the third. Now you understand third generation cephalosporin. Now if I write it the cefoperazone. So one was in which category? Me 110. So Me 110 again the third generation. So remember this is the, and one more drug, that is the ceftazidime. Ceftazidime. So ceftazidime, it is the most effective against the Pseudomonas. All these drugs are the for Pseudomonas, and this is the most effective. This you need to understand. Okay. Then other you can forget, but you can remember is the cefipimes as well as the ceftazidime. They are the third generation and they are effective against the Pseudomonas. Ceftriaxone. The ceftriaxone, they are effective against the gram-negative streptococcus. They are effective against the gram-negative streptococcus. Just remember this one, and if you want to remember this one, if you want to revise these things, and just remember these things for the Krok 2, remember these things for Krok 2, this thing for Krok 2. Okay, I hope I am clear. Okay, now the next drugs we have studied about, that is the fluoroquinolones. The fluoroquinolones that we already discussed again, or you maybe study already in the Krok exams. 1. Quinolones. See, the fluoroquinolones, these are the drugs that ending with the axine. See, we have like examples, we have the ciprofloxacin, we have the moxifloxacin, and the moxifloxacin. This ciprofloxacin, this is used for UTI. This is used for the UTI infections. Moxifloxacin, this is used in case of respiratory infections. So remember these things. Ciprofloxacin used for the urinary tract infection. If any urinary tract infections, what we can prefer? We can prefer the ciprofloxacin. But if there any respiratory infection, what fluoroquinolone drugs we can prefer? That is the respiratory. That is moxifloxacin for the respiratory infections. Okay. What is the side effect of the fluoroquinolones? It should be never given to the children because it causes the cartilage damage. It can cause the cartilage damage. And along with that, we studied about the tetracyclines. So remember the tetracycline, what they cause? What is the side effect of that? They cause yellowing of the teeth. Yellowing of teeth. Okay. I hope this is clear. Yes. Matronidazoles. Next drugs we have the matronidazoles. Matronidazole we studied that is used for the anaerobic infections. Any parasitic infections we also use the, like the entamoeba coli or hookworms. For those infections we also discussed that we can use the matronidazoles. Matronidazoles, along with that we can also use for the, in case of GIT ulcers, like GIT ulcers because of the Helicobacter pylori. And Helicobacter pylori, what they have, they are the grow in microphilic conditions. Okay. Along with that, we can also use in this case of Trichomonas vaginalis. In this Trichomonas vaginalis, what we studied? We studied there is a strawberry tongues. Can you just write me in the chat box, anyone? What, where we, in which condition we find the strawberry gums? Please write me. I forgot actually. I have very little memory. Can you just write me? Strawberry gums are seen in Saphipime. Saphipime is fourth. Yes. Nahi, Saphipime. Yes, Saphipime is fourth. So you can remember Saphipime. P-I plus me-E. Saphipime plus me. I will kill you, Roms. I will fix you. That Ukrainian teachers say na. That is seen in Wagner's. In the scarlet fever, what we get? We get the strawberry. Oh, sorry. We get the strawberry tongue. Here, what we get? We get the strawberry vagina. Here we get the strawberry vagina. So remember, when the Wagner's granulomatosis, what we see? We see there is a strawberry gums. But in case of Trichomonas vaginalis, strawberry vagina. In case of scarlet fever or Kawasaki disease, we will study about, what we have? We have the strawberry tongue. Okay. So remember this thing. Then the next one we have, we studied about the hypopaxis. We studied about hospital acquired pneumonia. See, in case of hospital acquired pneumonia, hospital acquired or community acquired pneumonia. There is two things: hospital acquired pneumonia, and there is a one more, that is CAP. CAP, we have the community acquired pneumonia. We have the hospital acquired pneumonia and we have the community acquired pneumonia. So in hospital acquired pneumonia, the drugs we can use having the piperacillin, piperacillin. Should we write it full again? Piperacillin, tazobactam. Along with that, we can give we should give the MRSA. What is the MRSA? The drugs vancomycin. So you can just remember what we can have: the vancomycin plus we have the piperacillin, tazobactam. That you need to remember. In case of community acquired pneumonia, the drugs we gave in here is the third generation cephalosporin. Third generation cephalosporin, Me-110. Third generation Me-110. That is third generation cephalosporin. And along with that, what we will give? We will having the macrolides. We will having the macrolides. Okay. Then next one we have the meningitis. That is very, very important. Meningitis we will study and then we will further do. Pediatric pneumonia, that is oxacillin plus aminoglycosides. Then in case of meningitis, we can give having the ceftriaxones plus steroids or the chloramphenicol plus prednisolone in case of meningococcemia. So first we will study about the meningococcemia and then we will discuss about it. Okay. So now let's move to the next questions. The next question: a 3-year-old child has been suffering from the fever, cough, coryza, conjunctivitis for 4 days. He has been taking the sulfa-dimethoxamine Today it has fever up to 39 degrees Celsius, or there is a maculopapular rash. So maculopapular rash we see in case of measles, we see in case of rubella, we see in the case of scarlet fever, we see in the case of mumps. So in all these cases we see, except of the rash, the child's skin has no changes. What is your diagnosis? There is no changes, just rashes is there. So what condition? See, first we see there is a 3-year-old child. What we see? 3-year-old child. There is a cough coryza conjunctivitis. The strong history of cough coryza conjunctivitis. Nothing you need to understand. Just mark the measles. In the measles, if you are getting the 3C, these are the very important. Cough coryza conjunctivitis. He is taking a drug for that. Today it has fever up to 39 and maculopapular rash. We know there is a complex spot and the maculopapular rashes is there on the measles that we will study. I hope this is clear till now. Now let's go one by one and go for everything. We will cover measles, we will cover the mumps, we will cover the rubella, and we will cover the scarlet fever here. Okay, so be attention because this part is very important. Again, this is a very important part, so that you need to understand, and I wish 1 or 2 questions should be from here. Okay, so let's see. So it was question number 15. So one we already studied about the rashes. All rashes we will study. So one rash we studied, that is the Kawasaki disease, in which we studied about that there is a maculopapular rash and there is strawberry tongues. Now before going to that, there is a fever with the rash on day, so what we have studied here, see, there is a cough coryza conjunctiva for the 4 days, and here is the maculopapular rash on its face on the 4 days. So we are seeing that if there is a fever with the rash on which day. So if we are getting the rash on the day 1, we are the patient having the fever and on the day 1 he got the rashes. So what conditions can be the possibles? So that is seen in conditions, the day 1 rash is seen in varicella. That is seen in varicella. And what is the varicella? What is the cause? The cause of the varicella is the chicken pox. Chicken dinner. That is a chicken pox. Then this day 2, remember we have, that is scarlet fever. The day 2 is what we have, the scarlet fever. The rashes in scarlet fever comes in the day 2. The day 3 we have the smallpox. The day 3 seen in smallpox. Or you can remember the mnemonics here as well. Very sick people. What the say? Very sick people must take the double tea. चाय है तो सब है, चाय नहीं तो कुछ नहीं, है ना? That should be the logo of everyone, है ना? So this should be the chai is love, everything. The very sick people must take the double tea. So we will having the day 3, the smallpox. Then we will having the day 4. See, the day 4 in what we have the measles. The day 4 we have the measles. M for measles. Then day 5, remember we will having the day 5, the rashes that we seen in the case of T4 we have the typhus. So scrub typhus. I'm just speaking it out. If you have any mistakes, just forgive me, please. The day 6, what we will having? We will having the rashes of the dengue fever. The dengue fever, the rash fever with the rash, that is seen in case of the day 6. On day 7, we got the enteric fevers. So because of the mnemonics, I wrote everything, but in your syllabus, you have to know the scarlet day 2 fever, day 1 fever, smallpox fever, measles, and scrub typhus as well. Dengue fever, there is no one will ask you. They can be asked, but most probably they will not ask. So okay, so the very sick people must take double T. So V for varicella, S for scarlet, P for smallpox. P for what we have? We have the smallpox. So P for, remember, we have the smallpox, and smallpox is eradicated from the world. Measles, scrub typhus, dengue fever, enteric fever. That you need to remember. Now let's continue. I hope this is clear. Now see, along with that, you will get somewhere. I think we studied already some questions before, and in one question there was a disease, that is third day disease. I hope these questions will repeat. Here is no. So in one question there was that something like that. See, if you are seeing in the questions, there is a one first day disease, the first day disease. So first day disease is known as the measles. The measles is first day disease. Measles is first day disease. The second day disease is what? That is scarlet fever. The second day is what? Scarlet fever. Okay. The third day disease. The third day disease. This third day disease is what? That is rubella, German measles. Then fourth day disease is what? That is Duke's disease. That you don't need to remember, just for writing, because I am writing these things, so you can forget these things. Okay, you can, what mark I should, you can ignore this. Okay. Then the fifth one we have, that is fifth day disease. The fifth day disease is what? The fifth day disease is the erythema infectiosum. Erythema infectiosum. Then sixth day disease is what? That is the sixth day disease is what? That is the roseola infantum. This one you should remember. I am revising it again, so you should have use your vocal cord to what? To speak with me. So that you should use. See, if you are getting the first day disease, that is measles. Second day disease is the scarlet fever. Third day disease is the rubella. Fourth day disease is the Duke's disease. Fifth day disease is the erythema infectiosum. Sixth day disease is the roseola infantum. We will revise it and we will remember this for lifetime here. Okay. So see, tell me, speak with me. First day disease, that is measles. First day disease is the measles. Second day disease, the second day disease was, yes, you are right, scarlet fever. Don't see your notebook, just think about it. Third day disease, that is, yes, rubella. Fourth day disease, that is Duke's disease. Fifth day disease, that is erythema infectiosum. Sixth day disease, that is the roseola infantums. Okay, speak it again. First day disease is what? Measles. Close your eyes and speak with me. First day disease is the measles. The second day disease is the scarlet fever. The first day disease was the measles. Second day disease was the scarlet fever. Third day disease was the rubella. Third day disease was the rubella. Fourth day disease, no need to remember, that is the Duke's disease. Fifth disease is what? That is erythema infectiosum. Sixth day disease is what? That is what? Roseola. In the question you will get the direct keyword first day, second day, it comes a third day disease. So you will easily understand that is talking about these conditions. Okay, let one more time. I want you everyone to one more time. So let's speak with me. The first day disease. Okay, just see first time. Just see it and then we will study. Just revise it, and then after that you need to you need to promise me you will close your eyes and then you will speak with me. Measles, scarlet fever, rubella, Duke's disease, erythema infectiosum, roseola infantum. This is the important, that's why we are getting the time here. The first day disease, measles. The second day disease, that is scarlet fever. The third day disease is what? Now you will write me. The third day disease is what? That is rubella. The third day disease is what? Rubella. Fourth day disease is what? The fourth day disease will be, that is question 10, third day disease. Fourth day disease is the Duke's criteria. Fifth one is erythema, and the sixth one we have the rubella infantum. Okay, so that roseola infantum, that you need to understand. Okay, this is the important point, so you need to remember these things. and use these techniques for remember. And if you don't understand anything, you need to first revise what is the difference between the first day disease versus rash on the first day. So there is a rash. This one you will understand why we called it the first day, second day, and third day disease. And this is what that we are getting the rashes on this day. If you are getting the rash on the day 1, this is seen in case of varicella. In scarlet fever, we get the rash on the second day. Smallpox, we get the rash on the day 3. Measles, we get the rash on the day 4. Scrub typhus, we get the rash on the day 5. Okay. I think I need to close this. It's okay now. Okay, so the next one we have what? That is, now let's talk one by one and everything will be covered. So don't worry. So we have the measles. We have the measles. Let's talk about the measles. Let's talk about the what is the measles. Remember the measles. If you talk about the measles, what that it is caused by the single stranded RNA virus. The single stranded RNA virus, and family for here is the paramyxoviridae. This one you should remember. Then remember that in measles we have the some clinical features. This is CF is what? That is the clinical feature. CF is what? Clinical features. So in this what we will see? I will Shruti Singh. I will explain it here. Don't worry. It will come one by one. So just for now, just remember these things and you will be able to understand what I am saying. See the clinical features. What we are seeing here, we will see there is cough, coryza, conjunctivitis. So what we are seeing, cough, coryza and conjunctivitis. Okay, cough, coryza and conjunctivitis. This you need to remember. They have the centripetal distributions. The centripetal distribution. This one we will come. Then remember that most common complications. The most common complication, that is what? Otitis media. The most common complication of what? Measles. That is otitis media. And the most common cause of death. The most common cause of death in measles, that is pneumonia. The most common cause of death in measles is what? That is pneumonia. That is pneumonia. And which is the most common late complications? Most common late complication. That we will study just after this. That is we have the work. This is the important point, and we will see. I will share the images as well for these conditions. So we will having the subacute sclerosing pain, encephalitis. Sclerosing pain, encephalitis, or also we can having the Warthin. This is the very important keyword for this. Warthin-Finkel-Day giant cells. Warthin-Finkel-Day giant cells, and this is multinucleated, also known as the Koplik spot. Also, what we will see? We will see having the Koplik spot. Warthin-Finkel-Day giant cells. This is the multinucleated, and this is known the spot that is seen opposite of the molar M1 and M2. That is what? Koplik spot. I hope this is clear. The most common complication, otitis media. The most common cause of the death in the measles, that is the pneumonia. The most common late complication is the subacute sclerosing pain, encephalitis. And the management, remember the management for the, I hope this you understand, this is the management. And management for the measles is vitamin A. Management for the measles is the vitamin A. Now let's see what is the centripetal and what is the centrifugal before going to the next part. So see the centripetal and the centrifugal. So we have one condition, that is the centripetal, and another condition we have that is the centrifugal. We have the one condition, that is the centripetal, and another condition we have the centrifugal. So this is very easy, very easy to remember. See, in the centrifugal, if I will say the distributions centripetal. So remember, for that centripetal we will having the pate. What we having the pate. So this is, you can remember the pate, or you, for English speaking, you can remember the pat. What you need to remember? The pat, any pat. So what you have the pat, so then we have the centripetal. So if, I think I need to make the diagram. Okay, just a not a good diagram, but just for understanding. Okay, this you need to understand. See, if you are getting the any distributions, more distribution on the central area, the more type of the like rashes, or there is a rashes, more rashes in the centripetal regions, or then the pate regions. That is what the centripetal regions. That is what we have the centripetal. These rashes, they started in the like in the periphery. These rashes, they started in the periphery. The rashes started in the periphery, but they spread to the centripetal regions. They spread to the centripetal regions. They are the rashes that we are seeing, and these rashes, they spread to the central regions, and what they will form? They form the centripetal distributions. They form the centripetal distribution. So remember, who have the pate? पेट किसका होता है? पेट होता है हमारे CM का. तो remember that we have the chicken pox and measles. We have the chicken pox and measles. Chicken pox, and what we have the measles. In the chicken pox and in the measles, what we will be having? We having the centripetal distributions. In chicken pox and in measles, what we will be having? We having the centripetal distributions. Okay, so पेट किसका होता है? पेट होता है किसका? CM का. पेट होता है किसका? CM का. So that you need to remember. For English speaking student, remember, if we having the pat, we have the pat. So the pat is what? Pat. Who have the pat? CM, the chief minister, having the pat. The chief minister having the pat. Chief minister having the pat. और you हिंदी में याद रखने के लिए easy हो जाता है पेट, तो इस वजह से थोड़ा सा है ना, तो उसको ऐसे याद रखो, या अदरवाइज ऐसे भी याद रख सकते हो कि चीफ मिनिस्टर के अंदर चीफ मिनिस्टर हैव द पेट. सो दैट यू नीड टू अंडरस्टैंड चिकन पॉक्स एंड द मीजल्स. देखो सेंट्रीफ्यूगल में यहीं पे बना दे रहा हूं, ठीक है. द सेंट्रीफ्यूगल में क्या होगा? द रैशेस स्टार्टिंग फ्रॉम हियर, द रैशेस again I'm drawing for the centrifugal. The rashes starting in the central regions, but there you will see the more rashes in the periphery area. The more rashes in the periphery area. The more rashes in the peripheral areas. So this things, this type of the things you will find. The more rashes in the peripheral areas, that was meant centrifugals. And what is the example of the centrifugals? The example of the centrifugals, I am writing it here. So remember, we have this in case of the centrifugals, the rash in the fuse, F for far, F for far. So remember the rash in far areas, rash in far areas. So in which condition we will see? We will see in the case of smallpox. There is a one disorder that is called that we call the HFMD, that is hand, foot, mouth disease. This is the hand, foot, mouth disease. Remember, hand, foot, mouth disease. Then in case of one more condition, that is acrodermatitis, acrodermatitis enteropathica. This is important question. See, in acrodermatitis enteropathica, remember one thing, that in acrodermatitis enteropathica, what the element mineral deficiency we have? That is the zinc deficiency. So you need to remember these things. If in acrodermatitis enteropathica, there is a, you need to remember the two questions from here. There is a centrifugal distribution as well as there is a zinc deficiency we seen in case of acrodermatitis enteropathica. Pate, remember, you need to remember the example, chicken pox and the measles. The pate, you need to remember the examples, or the pat, you need to remember the examples, that is chicken pox and the measles. So measles we just studied, that is what type of the distribution we have, that is the centripetal. So pate, always remember the pate or the pat, and who having the pat or who having the pate, so that is CM, that is CM. I hope this is clear. Then the next one, what we have, we having the mumps. See, mumps. So mumps, remember, that is common. See, the measles is common mainly in the more common in the children's, like the people or the infant, like 3 year, 4 year, 5 years, and but mumps, remember, that is common in the people's like in people having the 18 year to 40 years mainly. In these peoples, we will see there is a mumps that is very commonly. Okay, then remember that again the mumps, it is caused by the RNA virus. Then remember that in these conditions we will see there is a unilateral cheek swelling. Unilateral cheek swelling will be there. Unilateral cheek swelling. So we will see there is a cheek swelling और सूजन दिखेगी कहाँ पे, गाल के अंदर, and this cheek swelling will be the tenders. And one of my junior student, she is having the mumps currently. She just called me 3 days back and she told me that it is very painful conditions, and she can't swallow, she can't eat anything, and she was on the drugs, and it takes minimum 5 days to subside. But in that condition, if doesn't subside, it can lead to the bit more common in the boys, but also you can see that it can seen in females as well. There is a unilateral, what we will see, unilateral cheek swelling, and there is a more tenderness will be there. What is the most common complication? The most common complications. The most common complication of the mumps. The most common complication of the mumps, that remember that it is what? It is that is aseptic meningitis. That is aseptic meningitis. Aseptic meningitis. And other one, we have the orchitis. Orchitis. What is the orchitis? Inflammation. Orchitis is the inflammation of testis. The inflammation of the testis. Okay. What is the treatment we will give for the orchitis? We will give the scrotal sport. The scrotal sport we will give. Along with that, we will unilateral cheek swelling. So we can say there is it's due to parotid gland inflammations. Due to this is due to parotitis or the parotid gland inflammations. We will see the cheek swelling, and along with that we will see there is a pain in the, there will be the pain, and where will be the pain? Pain in the temporomandibular, because of that pain in temporomandibular, the pain in the temporomandibular joint. Okay, the pain in the temporomandibular joint. So remember these things. If we have the pain in the temporomandibular, person will not able to chew, person will not able to swallow as well. Then in the mumps, remember that it can cause the infertility. It can cause infertility, yes or no? It can cause the infertility. Answer is yes, it can cause the infertility as well. I hope the mumps point is clear here. Now let's continue with our next one, that is rubella, or let's first continue with the rubella and then we will study about the chickenpox. See, the rubella, another name of the rubella is known as the German measles. What is the another name of the rubella? The another name of the rubella is the German measles. Or we also call this condition as the third day disease. So we can call this as the third day measles. Third day measles. In that conditions, in the rubella, what we will see? We will see the red rashes is there. Red rashes will be there. Then we will having this is the fine pink rash. There is a fine pink rash where appears on face and trunks. Appears on face and trunk. They appears on the So what we will be having? We have the red rashes. What will be there? Fine pink rash appears on the face and the trunks. Then there will be seeing the stuffy or runny nose. What we call these conditions? Cough, coryza, conjunctivitis is seen in measles. Here what we are seeing? Here we are seeing the stuffy or runny nose. So we can see here the coryza. The coryza, along with that patient will having the mild fever, and that will be less than equal to 39 degrees Celsius or 38.9 degrees Celsius. There will be the red itchy eye, and that is called it conjunctivitis. So if there is a cough, coryza, conjunctivitis, so that's which what? Measles. But if it is the coryza or conjunctivitis along with the red rashes on the skin or on the face or on the trunks, that we call this a rubella, because rubella is also what? German measles. So some feature of the measles will come. There will be the enlarged tender lymph node. There is an enlarged tender lymph node at base of skull, at the base of the skull, or maybe we can say at the back of the neck, or we can say these conditions as the mainly at the tender lymph nodes at behind the ears. Any keywords can be get behind the ear, or we can say at the occipital lymph node. We can say this condition as well, occipital lymph nodes at the base of the skull, or we can see the base of the necks or behind the ears, or other conditions we can see these things as the behind occipital lymph nodes or the occipital lymph node. I hope this is clear till now. Now remember the patients can having the pain in the joints. Yes, the pain in the joints is also possible. There is a pain in joints is also possible. Along with that, you need to remember the patients having the rubella complications or the tride that we can see in the conditions. So remember, these patients will having, you can remember the tride for this, that is very, very, very important. Then we having the deafness, CHD, and other than that we having the cataract. Okay, so what the complications? That is deafness. What is the CHD? Congestive heart disorder. Congestive heart disorders. And other than that, what we can see, the patient will having the cataract. Okay, so this you need to remember. I hope this is clear. Done. So rubella, red rashes you need to remember. Along with that, there is a deafness, there will be the congestive heart disorder, and the cataract will be there. Okay, now let's continue with the other topic, that is we have chicken pox. These four topics: measles, mumps, rubella, chicken pox. Very, very important topic. So you need to remember these things. Now remember, we have the chicken pox. So chicken pox we can cause that it is also known as the varicella disorder. Varicella, because it is caused by varicella zoster virus. It is caused by the varicella zoster virus. Varicella zoster virus cause chicken pox. Varicella zoster virus. Okay, so the chicken pox or the varicella, it is caused by the varicella zoster virus. So that you need to remember. In chicken pox, that you need, very, very important keyword, that is dewdrop appearance. What is that? Dewdrop appearance. Dewdrop appearance will be seen. The dewdrop appearance that is seen in case of chicken pox. What is the distribution for this condition? That will be the centripetal distributions. What type of the distribution? The centripetal distributions. Along with that, what we will be having? Maculopapular. See, maculopapular, all these rashes will be seen in all conditions. Maculopapular rash. Along with that, here we have the maculopapular vesicular rash. Maculopapular vesicular, because it's caused by the varicella, and what they will cause? They cause the vesicles. So the vesicular rash will be there. Okay. Okay, the questions, I think so. Many of you already having the chicken pox in your childhood, जिसको बोलते हैं ना हिंदी में माता निकल गई है ना, तो दैट कंडीशंस, ठीक है. सो दैट इज द मैक्युलोपैपुलर वेसिकुलर रैश, एंड व्हेन द पीरियड ऑफ कम्युनिकेबिलिटी विल बी देयर, this if they will make the questions hard, so that this can be the ask. The period of communicability, so in the period of communicability, remember, so when all the vesicles, when all vesicles they will rupture, when the all vesicles get ruptured, so that the all vesicles get ruptured, so what that will cause, they have the communicatings, and everything will becomes, when it will be ruptured or crusted, ruptured or crusted, so what will be there, I have still having the, I have one mark here, and that will become the blackish color, black, it will become the blackish. Okay, this one you need to remember very, very importantly. This is clear for everyone? Okay, now let's go to the important questions of 2023 paper, and this questions asked this time, like incubation period was asked about the measles, about the chicken pox. So let's revise all the incubation period. So remember the incubation period, this is IP is the incubation period, incubation period. So the measles, remember measles we have the 8 to 12 days, 8 to 12 days. Then mumps, remember we have the mumps, they have the incubation period of 2 to 4 weeks, 2 to 4 weeks. Then remember we have the chicken pox, and the chicken pox, what is that we will having the 10 to 21 days, 10 to 21 days. Then remember we have the syphilis, the syphilis what will be having 9 to 90 days, the 9 to 90 days. And this you need to remember, the measles, mumps, chickenpox, and chickenpox is important, other than you can remember measles or the mumps, that you need to remember. I hope this is clear. Now then let's discuss about the another one, that is the 5th disease and the 6th disease, because that can be the ask, and that can be the, like the history of the image can be the given. See, if you are getting the 5th disease, what was that? That is the erythema infectiosum. Erythema infectiosum. So erythema infectiosum, remember what is the cause of that? The cause is parvovirus. This is the question that they will ask. What is the cause of erythema infectiosum? So remember that is parvovirus B19. The parvovirus B19 is the cause of the, it is the cause of what? That is 5th disease, that erythema infectiosum. So what will be there? There will be the slapped cheek appearance. Like if this is child, the child from the, this is the child, so this will become the reddish. Why? Someone put the slap on his cheek, so it will give the appearance of the slapped cheek appearance, Okay, then we have the another one, that is the 6th disease, and 6th disease you need to remember, that is the roseola infantum. Roseola infantum. See, the roseola infantum, what is the cause of that? The cause is HHV, human herpes virus. Which one? 6 and 7. The human herpes virus 6 and 7, they cause the roseola infantums, and in that conditions we see there is a Naga Yama sports. This one you as see in the question as a keywords, the Naga Yama sports. So if you are getting the keyword something like that, Naga Yama sports, so that you need to understand that this is talking about the roseola infantums. Okay, And this one, roseola infantums, you can remember, like if you will having the like the fever, yeah, the roseola infantum. So rose, remember rose, that is which one? That is the sixth disease. Okay, the rose, that is sixth disease, you need to remember. Or you can remember, like if you will any like any cricket player is there, so if you will make the, if you will get the, if you will make the six, then what you will get? You will get the rose. So you need to understand, and you need to make some mnemonics by yourself also, that everything should be in your mind, and that should be your target. Okay, so please revise this, and or take this some water, and then we will continue further. Okay, so let's take how many minutes? 5 minutes break. I think 5 minutes is more than enough. So take the 5 minutes break, and after that we will start at just after 5 minutes. Okay, I hope everyone is clear और सबको समझ में आ गया. Just एक thumbs up दे दो. कोल्ड ड्रिंक नहीं मांग रहा मैं. तो समझ में आ गया तो इसको रिवाइज भी कर लेना, है ना. रिवाइज इट टुमारो वेरी वेरी वेल. नहीं तो मज़ा नहीं आएगा ना अगर एक तरफ से हिम्मत एक तरफ से चलता रहा दूसरी तरफ से कुछ नहीं हुआ. Okay, so better revise everything again. Like if you are preparing it, studying it today, make sure that you are revising on the same day. Hello. Hello. Okay. Okay, there was one question. Shruti Singh, what is the meaning of the 1, 2, 3? Could you please explain? See, there is a, if you talk about the 1, 2, 3 digits, is based on like how we are, these are the another name, you can remember it as the another name of the digits. Like if you are seeing that, if you are seeing the first day digits, we call the measles. The second is bit, it is based on the like when we are getting the, when we are able to differentiate the races. When we are able to based on the differentiation of the races. ये तुम्हारे मेरे जैसा कोई साइंटिस्ट था, ठीक है, तो वो जो है वो ये मतलब नंबर लगा के चला गया. This number is given by him, by any Tatpunja scientist, है ना. So don't, so just remember if you have any first day digits measles, so it is based on like when we are able to differentiate the races. So based on that we are getting like it is measles, then second is scarlet fever है ना. एंड फीवर विद रैश, अगर फीवर और रैश दोनों एक साथ आ रहे तो डे ऑन द डे 1 पे आ रहे हैं तो वो हमें फीवर विद रैशेज याद रखिए कि कौन से दिन पे विच एवर रैशेज आर कमिंग्स. आई होप एवरीवन इज क्लियर and you don't have doubts. If you don't need to remember कि ये क्यों हुआ था, क्या हुआ था, first day disease, why we called it first day disease, why we called second day disease, the main thing you need to remember the name. The first day is called the measles, the second day is called the scarlet fever, third day is called the rubella, then for fourth day you don't need to remember because ये जो है वो हटा दिया गया. This is unacceptable now, or it has been removed, we can say, है ना. So this you can skip. Let me write it completely tips. So fourth, like because I know if I will write it 1, 2nd, 3rd, and after that I will write the 5th one, then you will simply ask me, oh, why we call the fourth day digits? Because what is the key inside you that just keep happening. ठीक है. Okay, so now let's continue about our new questions. A 2-year-old girl has been ill for. Okay, let's do the previous question before. So here we are getting the 3-year-old child and is suffering from the fever, cough, coryza, conjunctivitis, and maculopapular rash on its face. I just told you there is a what type of the rashes will be there. Centri or distribution is what type? CM. So we have the, remember it's not mumps. We have the measles. That is centripetal distributions. Today she has a low grade fever, severe catarrhal presentation, slight macular papular rash on her buttocks and enlarged occipital lymph node. And this patient has been ill for the 3 days. The patient has been ill for, now see, a 2-year-old girl has been ill for 3 days. So what we call the 3-day disease? That is rubella. Low grade fever, yes, we know that we studied that there is a stuffy or runny nose and there is a mild fever will be there. So that's why, sir, there is a low grade fever. Severe catarrhal presentation, yes, sir, there will be the severe catarrhal presentation. Catarrhal means just a, like the inflammations will be there, like conjunctivitis. This is again the inflammations. Slight maculopapular rash on her buttocks and enlarged occipital lymph node. Yes sir, maculopapular rash, like the some like fine pinkish rash will be there on the buttock, and that will be rubella. Okay, scarlet fever we will study. Adenoviral infections, there is nothing about the infection, viral infection here. Pseudotuberculosis, pseudotuberculosis, if it's related to the like any tuberculosis disorder, that we will comes with the when the tuberculosis will be done. The measles, we know that there is Warthin-Finkel tangential scopic spot is there, so it will not be the answer. A 3-year-old boy fell ill abruptly, fever up to 39 degrees Celsius. Or like let's, I think I told you that we will study about the scarlet fever also. So let's discuss about the scarlet fever as well. Because from the scarlet fever also, because we already studied about the Kawasaki disease, and we have just remaining with the scarlet fever. See, the scarlet fever, we studied about the Kawasaki disease. The Kawasaki disease and all these are the bye-bye. These are the bro. So that you need to remember. So remember these things. If you are getting the scarlet fever, that is the group A beta hemolytic streptococcus. It is caused by the group A beta hemolytic streptococcus. And remember that there is a fever with rash on second day. That we just studied, the fever with rash when it appear on second day. The fever with rash appear on the second. The fever with the rash, they appears on the second days. Okay. Then remember that they have these like the rashes in the scarlet fever. They start from the face. And where they spread to the trunk. Now you tell me which type of distribution is that. Write me in the chat box which type of distribution is that. They start from the face and then they spread to the trunk region. So which type of distribution is this? Centripetal or is it centrifugal? It is centrifugal. F means far away. So this is the centrifugal distribution. So they start from the face and they spread to the trunk. Very, very good. Sue and Anurag, Mani, Anuj, very good. Well done. They start from the face and they spread to the trunks. That's centrifugal. Remember the point, important point, or the important catch here. That is, they never involves palms and foot. They never involves palms and foot. Who involves the palm and foot? Kawasaki disease. In Kawasaki, they involves the palm and foot. Kawasaki disease, yes, we studied that they involves the palm and foot. And also there is one more disorder in which palms and foots are involved, that is hand, foot, mouth disease. Hand, in that condition, hand will be involved, foot will be involved, and mouth will be involved. That is hand, foot, mouth disease. That we will not study. But just for a quick, and also we studied that in the hand, foot, mouth disease, we have also the centrifugal distribution. I know that you know everything. You are the good students. The never involves the palms and the students. Then remember that the scarlet fever, the most characteristic feature, if you are getting the in the questions, the sandpaper-like rash. Sandpaper-like rash. And in the sandpaper-like rash is there in the questions, and after that they are asking like in the option there is scarlet fever, then you will just tick the answer scarlet fever. As rashes make the skin, what they will do, when these rashes will appear, then the skin will become so rough like the sandpaper. So that's why we call this condition as the sandpaper-like rashes. Along with that, we will be having Pastia's lines. What lines? Pastia's lines. So we will having the skin crease, and in that crease there is a accentuations of the rashes. The Pastia lines, I will share you the image, then you will able to easily clarify that is the Pastia lines. Other things what we will see the patient will having the sore throat. Arey yaar, that we already know na, कि we having the group A beta hemolytic streptococcus, we having the sore throat. Don't tell us, we know everything. Then what will be there? Sore throat, we will see there is a pus in throat. Pus in throat. The associated tender cervical lymphadenopathy. The associated cervical lymphadenopathy. So these conditions we also see. Okay, my God, right? So this is the most commonly which one? That is the anterior group. So just remember we have the cervical lymphadenopathy also seen in case of scarlet fever. And one more thing, we have just studied about the strawberry. The strawberry tongue is also seen in scarlet fever. So what is it is due to? DT is due to hypertrophy of papillae, the hypertrophy of papillae, and due to intense inflammations, Okay, this you need to understand. So if we have the strawberry tongues, they are associated tender cervical lymphadenopathy. We have the strawberry tongue due to hypertrophy of the papillae and due to intense inflammations. We will be having the hypertrophy. And remember, this is due to hypertrophy. See, what is the hypertrophy and hyperplasia? I hope every one of you knows this. Hypertrophy and hyperplasia. Are you seeing any S in the hypertrophy? If no S, means that cannot be the S. This is the cross mnemonics. If no S is there, means it will be increase in number. If it is no S, then it is increase in number. If there is a S, that is the thing. Everyone knows the size and number. But the problem is that if when we have hypertrophy, when it will be there, increase in number. But in the S, there is will be the increase in. Oh, मैंने गलत कर दिया. Sorry. This is the opposite thing, na? So we are getting the increase in the size. So we have the increase in number, and this is increase in size. Okay. So hypertrophy, we are getting the increase in size. But if the plasia is there, so here we are seeing the S is there. So in the answer we will not get the S. So remember like that. There is increase in number, hyperplasia. But if there is a no S, means yes, there will be the S. So increase in size. Okay. I hope this is clear. Then what is the treatment? Remember the treatment for the scarlet fever. That is again penicillin G. That is the treatment of the choice, and minimum we give for the 10 days. That you need to remember, the penicillin G. No need to remember about the durations. What are the complications? This one you already know. That is what is that? Acute rheumatic fever. It can lead to the post-streptococcal glomerulonephritis. So both these complications might be possible. Okay. See the question number. So the scarlet fever we also done. Now see the question number 17. A 3-year-old boy fell ill abruptly. Fever up to 39 degrees Celsius. There is a weakness, vomiting, hemorrhagic rashes. Oh my God! Krok questions. हमसे टक्कर. So that is hemorrhagic rashes of the various size appeared on his lower limb within 5 hours. अच्छा, so that is hemorrhagic rashes due to hemorrhage. They already given meningococcemia with infective toxic of the 1 degree. Yeah, this one we already know. I hope. है ना? No, meningococcemia. There is a in the meningococcemia we studied that there is a something like we having the toxic shock syndrome, we have the water Fredrickson syndromes, we have the all these occur due to adrenal hemorrhage. So that's why if there is adrenal hemorrhage, we will having the hemorrhagic rashes. So what medication should be? Oh, they asked the medication, but वो हमने नहीं पढ़ा, तो चलो वो पढ़ लेते हैं. So let's see meningococcemia. Meningococcemia. See, everyone knows what the meningococcemia caused by. It is caused by the meningococcus, or the meningitis. It is caused by the meningococcus. All these things, meningitis, encephalitis, I think we will study it tomorrow, because that is also the big topic. We will study it tomorrow. See, the meningococcemia, we know the complication. One, we also call this condition meningococcemia, or we can also call this toxic shock syndrome. So we can also call this condition as the toxic shock syndromes, and we can also call this condition as the Waterhouse-Fredrickson disease. Waterhouse-Fredrickson, F-R-I-D, sorry, Fredrickson disease, Waterhouse-Fredrickson disease. Okay, and what they will cause? They cause the adrenal hemorrhage. What will be there in the Waterhouse-Fredrickson disease? That is adrenal hemorrhage, and due to which we are getting the hemorrhagic rashes, and due to which what we will getting? We are getting the hemorrhagic rashes. So because of the hemorrhage, bleeding is there, and because of the bleeding, the rashes will be appears, and the rashes looking like the hemorrhage. So that's why we give the name as the hemorrhagic rashes. Now the question about the hemorrhagic rashes is what? That is the treatment. So what treatment we will give in this condition? That is our questions. See, if we are getting the questions about the like meningococcemia, so remember, if we having the two type of the meningococcemia, so sorry, we having the two type of the treatment. So we have the empirical treatment. Empirical treatment that you can give this as a like sportive treatment, you can take by yourself as well. So that things you can give the ceftriaxone or cefotaxime. Ceftriaxone or the cefotaxime. Now you can tell me one or me. Ceftriaxone or cefotaxime. These are the which group generations? Which generation drugs these are? First generation, second generation, or third generation? Which one? This is which generation? Cephalosporin. Yes, that is 3. Bilkul. Very, very good. So ceftriaxone. So try one. That is triaxones. What was that? Me 110. So ceftriaxone or cefotaxime plus with vancomycin. Cefotaxones with vancomycin. So this we can give as the empirical treatment. Now remember that if we will be having the like if you have the infections, Neisseria meningitis is identified. So if Neisseria meningitis is identified, what we need to do? Continue with only ceftriaxones. Continue with the only ceftriaxone or cefotaximes. We don't need to give the vancomycin. But if the patient is allergic to the penicillin, or cephalosporin, if the allergic to penicillin and and cephalosporin. So in that conditions we can give the patient as the chloramphenicol. Okay, or we can give the moxifloxacin. The moxifloxacin we studied for the respiratory. Here we are studying for the Neisseria as well. In case of, so first we have the empirical treatment ceftriaxone or the cefotaximes with vancomycin. If the Neisseria meningitis, only the infection Neisseria meningitis, they continue with the like ceftriaxone or the cefotaximes. If I are taking any drugs empirical treatment before, then if still we have the Neisseria meningitis infection is there, so then we will continue with only ceftriaxone, cefotaxime. If allergy to penicillin, we can go for the chloramphenicol or the moxifloxacins. Okay, I hope this is clear. Then also remember, if we are having the in case of meningococcemia or the pediatric meningitis, so in that conditions we will having the adrenal hemorrhage is also there. So in that conditions we will giving the chloramphenicol plus we need to give the prednisolone. See, prednisolone is what? Steroids, and we will having the adrenal improper adrenal dysfunctions. So to maintain that adrenal structure, we need to give the steroids, so that it will help to prevent the adrenal shutdown. Or prevent the adrenal dysfunction. So that's why we involve that is prednisolone. So for Krok point of view, if you are getting the pediatric meningitis, remember these drugs, and I already discussed everything with you. If you are getting this ceftriaxone, cefotaxime with vancomycin, that can also be correct. If you're getting the Neisseria meningitis, then continue with that. But if allergy to penicillin, cephalosporin, then we will give the chloramphenicol or moxifloxacins. So this is the drugs that is important for the Krok. Chloramphenicol and the prednisolone. Now see the questions. Hemorrhagic rashes vary appeared in lower limb within 5 hours. Meningococcemia infective were diagnosed. What medications would be prescribed? Now you can see we are having the penicillin and prednisolone. Can we give the penicillin and the prednisolones? Chloramphenicol, succinate and interferons. Here if we can give the prednisolone we can give, but with the prednisolone we need to give the chloramphenicol. Here we can chloramphenicol, succinate, interferon I didn't tell you. Ampicillin and immunoglobulins? No, never. And penicillin and immunoglobulins? No. So we will remaining. So we have the chloramphenicol, succinate and the prednisolones. And chloramphenicol, succinate is the good drugs for the meningococcemia in case of infective toxic syndromes or infective toxic shock, or maybe we will be having, because see also the toxic shock syndrome, it is also caused by the bacteria like streptococcus bacteria. They also cause the toxic shock syndrome, TSS. Okay, so that remember that things. This is here we are talking about the meningococcus. So that's why we are giving the drugs, or you can remember the drugs as the pediatric meningitis, chloramphenicol, succinate and prednisolone, pediatric pneumonia, mpox and the gentamicins. Okay, I hope this one is clear. Okay. Okay, sure. Okay. What is no? What is yes? See, there 18 questions. Again, this is big questions. Encephalitis and meningitis and everything we will discuss it today. So because this is we will discuss everything is about it. Like what is the meningitis and all the bacteria they decrease the glucose, tuberculosis they decrease the glucose. All these topics we will cover tomorrow, because this is a big topic, and big topic we already discussed about the measles and everything. So let it be one big topic for today. See, a 7-year-old girl fell ill immediately. Fever, headache, fever, sore throat is there. Fever, sore throat is there, and vomiting. Minute bright red rash appear in her reddened skin in 3 hours. It is more intense in axilla and the groins. You can also mark this one. You can also write in your notebooks in the rubella, in the scarlet fever. This is where it is more intensive in the axilla and the groin regions. Mucous membrane of oropharynx is hyperemic. Okay, mucous membrane of the oropharynx, that I told, that is the strawberry tongues. Grayish patches on the tonsils, that yes, that can be the tonsillitis, that can be the possible. Submaxillary lymph nodes. I told you there is a lymphadenopathy, so that here is what, which one? Submaxillary lymph nodes are enlarged and painful is there. So what is your diagnosis? The diagnosis here is the scarlet fever. In rubella syndrome, what will give you? They give you CHD, congestive heart disorder, cataract, or the one more thing was there. Okay, so these things we will give. Cataract, you will get the cataract, conjunctivitis, and along with that you have stuffy runny nose and the fever you will get. So this you need to remember the one tried for the rubella. And the measles, you remember there is a Warthin-Finkelday giant cells. There is a Warthin-Finkelday giant cells will be there. You remember the rubella, we have the deafness. The rubella we will having the deafness. Rubella, the deafness, CHD, and along with that we have the cataract. Measles, what you will see? We will see the scarlet fever. I hope this one is clear. Dysentery, this one, do you want to this one to, because this is already like we from our Krok 1 point of view, we already covered everything from dysentery, and I will share the images of the rapid revision, so you will be able to understand that things, not a big deal. See, if you are getting the abdominal pain, recurrent vomiting, then diarrhea and the tenesmus, stool occur 12 times daily. So there is a contain lot of mucus pucks or the sticks of the blood. So if you are getting, see, in the question already they are giving, so there is a stools with the blood, and a sigmoid gut is tender and harder. Just I am recalling you for your recall. So you see, we studied about the Salmonella typhi. I hope many of you watched my videos, and here there we are discussed. salmonella typhi, and we have studied about the Shigella dysentery. See, for this we studied the mnemonics, that is sit lid, sit lid. Did we studied this one? So we have this in case of there is a small intestine. So this is the small intestine. In the small intestine, typhoid. This is typhoid. The salmonella typhi, they cause the typhoid. So in the typhoid, small intestine is affected. And in the dysentery, this is the large intestine, or D4 we have the dysentery. D4 we have the dysentery. So in the dysentery, large intestine is affected. In the dysentery, large intestine is affected. Now you can see there is a sigmoid gut. Sigmoid gut is the part of the large intestine. The sigmoid gut is the part of the large intestine. Now you can easily understand this is talking about the Shigella dysentery. So what will be your answer? Dysentery. I hope everyone is clear. Salmonellosis. See, there is two options that we can choose, that salmonellosis, and also there is a Shigella. So here the salmonellosis is not there because in the salmonellosis small intestine is affected. I hope everyone is clear. Does anyone have any doubt in this? Yes or no? Please write. Okay. Okay, that's great. Hamza, Dr. Vishi. What's your full name, Dr. Vishi? Okay, now let's see next. Let's do the next questions. 21. The child has complaints of the night and hungry, abdominal pains. The child has complaints of the night and hungry abdominal pain. At fibroscopy in the area bulbous of duodenum, the ulcerative defect of 4 mm diameter is found. The floor is obstructed with the fibrins. See HP. What is the HP positives? Can anyone tell me what is HP positive? That is Helicobacter pylori positive. Helicobacter pylori positive. Then we have to administer the optimum scheme for these statements. So they are asking us for what? The treatment. See, in this condition we have the Helicobacter pylori. So this one is again the important one, because in Helicobacter pylori if you are given, so in Helicobacter pylori we give the triple therapy. Helicobacter pylori. So this is the microaerophilic conditions. I just told you about when we are talking about the metronidazoles. So they grow in the microaerophilic environment. Then we studied that it is the urease positives. Urease positive bacteria. It is the urease positive bacteria. Okay. Then remember the Helicobacter pylori. They cause Helicobacter pylori. They cause the gastric ulcers. Or should we write it? I read it here. Sorry. Helicobacter pylori, and what they cause? They are the microaerophilic urease positive bacteria. So what they cause? They cause the gastric ulcer. They cause the gastric ulcers. So what in case of, see, there is a two type of the ulcers we can see, and this is the important concept here. If you are getting the gastric ulcers and if you are getting the duodenal ulcers, the H. pylori, they can cause the gastric ulcer as well as the duodenal ulcer. In the gastric ulcer, when we are taking the meal, so after meal, the pain will exacerbate. Okay, after meals, pain will relieved. Why it is happening? See, in case of the gastric ulcer, the mucosa is affected. And when we are taking the meal, the gastric HCl secretion will be there, and this acidic environment, they will cause the irritations on the mucosa layer, and that will lead to the pain. In case of the duodenal ulcer, when we are having the food in the gastric regions, so from the gastric regions till the duodenum, it take the times. From the gastric regions to the duodenum, it take the times to go. So when we are taking the H. pylori, or when we are taking the, when you eating the meals, so when we are there will be the pain will be subsides for sometimes, but after some time we will get the pain in the duodenums, like after 2 to 3 hours we will get the pain during the duodenums. So remember this point, if you are having the gastric ulcer, so after the meal pain will be exacerbated. Duodenal ulcer, the pain will be relieved during the meal, but there will be the the pain like after the 2 to 3 hours. And also remember, NSAID if you are taking, they cause the atrophic gastritis. They cause the atrophic gastritis. When we are discussing about the COX-1, COX-2 pathway, there I told that non-steroidal anti-inflammatory drugs, COX-1 inhibitor. What was that? Like the example, we was having the aceclofenac, diclofenac, aspirin. What they was causing? They was causing the atrophic gastritis. So treatment for that is the stop NSAID. Stop NSAID, and what we need to do? We need to start COX-2. We need to start the COX-2. Okay. The treatment for any or the treatment for the Helicobacter pylori. Remember, this is the treatment. The treatment for Helicobacter pylori. The treatment for the Helicobacter pylori. We will give the triple therapy. We will give the triple therapy. What the triple therapy we give? We give the clarithromycin plus amoxicillin, that is, plus we give the pantoprazole or any azole we can give. Pantoprazole, omeprazole, so this we can give. Okay. So this we will give. Along with that, we give the metronidazoles. We give the metronidazoles, and when we are giving the metronidazoles, it becomes the quadruple therapy. It becomes the quadruple therapy. When we add the metronidazoles, it becomes the quadruple therapy. Quadruple therapy. Okay. This one you should be remember. Along with that, we can give the antacids so that it can prevent the mucosal wall from the hydrochloric acid, from the HCl secretion, so that we can be prevented. Okay. See now, there is a night and hungry abdominal pains, okay, at fibroscopic purpose of duodenum. So here the problem in the duodenum. So we will, due to which there is a night and hungry abdominal pain. See, the night is there because in the night there is a no food he is eating. The food will go from the stomach, it will go into the duodenum, and in the night, and when the patient will be the hungry. So there is a duodenum, the ulcerative defect of 4 mm diameter. The floor is obtained with the fibrin, and there is a HP positive history is given. So what are the treatment? We will give the triple therapy. So we will give the omeprazole. We will give the omeprazole or the pantoprazole. We will give the trichophylone. What is the trichophylone? We didn't study, na? Trichophylone, another name of what? Metronidazole. That is the trichophylone is the another name of metronidazoles. That you need to understand. So omeprazole, trichophylum, or what we need to give? Clarithromycin. Okay. See, we can give, if any, like if you will say that we didn't give the metronidazole or the quadruple therapy. So if you are adding the 4 drugs, you need to understand that we need to add the quadruple therapy. Normally we give the clarithromycin, amoxicillin or the pantoprazole, but along with that, if you are getting the metronidazoles, we need to remove the 1 drug, that we need to remove the amoxicillins. Okay, because both are what? Both are the antibacterial drugs, so that's why we need to, or the antibiotic, that's why we need to remove these drugs. 1 drugs we should given. But if more severe conditions, we need to give both these drugs together, or the quadruple therapy then we need to give. Before that, we were just studying about the metronidazoles. Now studied that in H. pylori, what the treatment we give the triple therapy as a treatment. I hope this is clear to everyone. Now do the next questions we have. Sir, which year is the paper from? No, sir, which year? This is the question from Hamza. Hamza son, this is the questions from the pediatric base. We are studying about the pediatric base. Krok to 2024 pediatric base. See, don't worry about the 2023. These are the old or new. Don't worry, because I have the questions list, and whatever the questions will not be covered or whatever the topics will not be covered, we will mainly focus on the topics that will be asked. So whatever the topics will not be covered here in these things, we will cover literally with this. I will share the PDF of all those questions, and then we will discuss all those questions. Along with that, we will study I told you from the mid of the March, we will study all the one question paper. We will start any question paper from the starting, and every day we will do like 10-15 questions every day. Not every day, one day in a week. The previous year questions, one day in a week from the mid-March, one day in a week. That we will do. Cover all topics in revision artly. That like the Krok 1 rapid revision, na? So that is the like rapid revision. So with like that we will cover everything. Like the Krok ones in the May. But for that, I think I need to take the classes for now regularly, and because I will get for the internships, and after that I get the little time. So I will now make sure that I will cover the 7 days. I hope everyone is perfect for now. Everyone is clearing with me. Everyone is vibing with me. Everyone is that is the good, because every day we will be having classes, and because in the later days I can having some issues with my internships and I need to go somewhere. So on that days, because I am free and I have the times, so now let's complete everything as much as possible, so that you will get the time for revision also. And in the later we should not focus more, or we should not work hard. At least we should work hard for now, so that we can finish the major of our chunk before, I think, January, April, before the April, like last of the before the May, we can say. Okay. Okay, now let's see the next questions. See the question number 22. A woman delivered a child. It was a 5th pregnancy, but the first mother blood group is A, Rh negative, and the newborn is Rh positive. The level of indirect. See, now you can see here. I think, hope so. I don't need to discuss anymore. See, if I told you if mother blood is Rh negative, mother blood is Rh negative, and if the newborn or the father is Rh positive, then there will be the case of Rh incompatibility. And what is the treatment for that? If Rh incompatibility, see, if any Rh incompatibility will be there, then remember these things. If any Rh incompatibility, the first child will not be affected. First child, or if these conditions will be there, like if the mother is Rh negative and newborn or father is Rh positive, the first child never affected. What the first child will do? First child will give the antigens to mother, and he will say to mama, please make the antibody for my brother or for my sister, for my junior, for my little brother and for my little sister, please make antibody, and mother will make the antibody then, and that antibody will attack the other new antigens. The new antigens, or the new baby, or the little brother of that child's, that antigens, or little sister of that children's. So on that, this antibody will be against that antibody, and due to which there is RH incompatibility factor will be there, and this child will be having condition known as the erythroblastosis fetalis. Erythroblastosis fetalis. Erythroblastosis fetalis. So this condition will be seen in the second or more after the second or after the first baby. So here we have the fifth pregnancy, and so of course but first delivery, but fifth pregnancy, but the first delivery is there. Mother blood group is the level of indirect bilirubin umbilical cord was the 58. See, the fifth pregnancy is there, so that means the child, the mother having the antibody, because the already transmitted by the previous child. Maybe it was undergo abortions or the stillbirth, whatever the conditions will be there, but the first delivery was there. The level of indirect bilirubin umbilical was the 58. Hemoglobin is 140. RBC is less in 2 hours. The level of indirect bilirubin turns. The indirect bilirubin is increasing. So the patient is going under the icteric anemic type, or they are giving also the icteric anemic type RH incompatibility. Choose the therapeutic index. So what we will do? Replacement the blood transfusions, conservative therapy. I hope this is clear. Any incompatibility, the first treatment or the first tactics we need to do is the blood replacement. The tactics we do is the blood replacement. Difference between A and B. What is A and B, brother? Bhuvnesh. Are talking about the blood group A and B? Tell me whatever you're talking about. Option A and B. Okay, replacement, the blood transfusions and conservative therapy, and the blood transfusion conservative therapy. Maybe there is some mistake in these questions, but here I think if the both questions will be there, then again the first questions will be the more correct. The replacements, blood transfusions, because we are having the they're talking about the whatever the bloods in the baby or whatever the blood that we need to replace. That's why the correct definition according to them should be this. But like this type of this thing note comes. There's the same question for us. We know that both options are right, but still if you need to go for that, we need to replace that blood. That's why the answer is there. It can be also the possible answer. Okay, the conservative. The other options are also conservative therapy, symptomatic therapy. So there is little things mismatch. But in the main exams, like if this type of the things don't happen, if the replacement is there, the replacement will be there. If there is a this type of the such type of the options will not be there. Right? So don't worry. Okay, so I think we have. Let me finish 22 and after that. Okay, so tomorrow we will discuss about meningitis, encephalitis, and then we will discuss about all the milestones. Whatever the milestones, the important according to the Krok 2, we will discuss only that, because milestones you will forget easily. So we will discuss only that, when the baby growth and when the baby times doubles and everything. But this type of the questions, the very last questions you will see. If I don't think so, this type of the questions will become. But it can be the come, so that we need to study. So this is again till the last line. Okay, so tomorrow let's more energetics, and we will finish tomorrow around 1 p.m. Indian time, means we will be having the classes around 4 hours. Okay, today we have just I think 2:30. So tomorrow we will be having till minimum 4 hours. So get ready for that. According to, just take the light dinner, so you don't be sleepy. So we will start at that time, and we will be having classes at 9:30, and we will try to finish as much as possible. So all the important topics and everything we're gonna finish. Basically from here we don't have started the pediatrics till now. That's the problem of the old base or all these bases. But we cover the syllabus. We are covering the syllabus, but it is not about the pediatrics. There is no pediatric question. These questions, there are the very less, like measles, mumps, rubella was the questions from the pediatrics. So that is that like the mixture of the questions. You will not see that the questions can be seen in the medicines as well. Okay, so I think I can open the video. Okay, let me open the video for this. Okay, I hope you understand everything. Okay, so yeah, you can see me now. So see, those who did not answer today, please revise everything. Those who did not revise also before, please revise. है ना? जो whatever we are studying, make sure you are revising that thing on time. Don't be a little, मतलब एक मिनट के लिए भी late नहीं होना. Don't late for just for 1 minute as well. See, this is very crucial time, and I know some like the peoples who if you have the 2 attempts only, है ना? And someone was saying about that you're getting the 1 attempt only, so that is the not true. See, that 1 attempt is only for those students who failed the last 2 attempts, and now so total questions in Krok will be 150 brother, 150 Neeraj Negi, 150 questions will be there, है ना? So there will be no, you will get the 2 attempts, but there will be no possibility, nothing. I will show you the one. I don't know where was that. Yesterday only, I think some student messaged me yesterday or before yesterday. I did not say in the conditions. I think but I don't know which phone number was that. But she had uh, like she failed in the last 2 attempts. She failed in the 2 attempts, and due to some reasons, I don't know whatever the reasons. So whatever the reasons, but she failed in the last 2 attempts, and after the last attempt, she tried too much, and the university expelled them. So after that, they make the passports and everything. So make sure that and some rumors are there that you will get the 1 attempt, but that is just for the students who failed the 2 attempts, and after that they need to repeat the whole year. After they need to repeat the whole year, and after repeating the whole year, they will get only 1 attempt. I hope you understand. So you are getting the 2 attempts, but if anyone failed both the 2 attempts, online or offline, whatever, then after that you will get just 1 attempt, no 2 attempt after that. You need to complete the whole year. So please make sure that whatever you are doing, please keep revising everything, and make sure that you are doing the questions paper. Doing the questions is must, very important. Along with that, you can use any website, and soon we will be having whenever I will be free, I will make exams, and before 5 days or before 4 days I will just tell you. So just be prepared, or I can tell you on the 1 day before as well, so just be prepared, and don't worry about at all, as we have. And so see you tomorrow. I hope everything is clear. Out of 150, how much needed to qualify the exam? 96, I think. 96 or 64% हो गया ना, 64% will be there, so 96 will be there. Yes, 96 will be there. 96 questions you should be done very right. And please be prepared whatever you are doing. और इसके अलावा if you have the times, please keep revising everything. You have the much material, I know, है ना? So along with that, if you are preparing for anything else, if you're revising that completely, like if you are able to revise the Krok 1 materials, please make sure try to do these topics only, है ना? Because you have the if you will start to revise the anatomy now, revise the pharmacology now, pathology now, it's better to revise these one, like better revise OBC, better revise the medicine topics, better revise the pediatrics, glomerulonephritis, है ना? You have, whatever you app you have or any other platform, whatever you have, just make sure that you are doing that perfectly. है ना? You can prepare for whatever your exam preparing. Some are preparing US Assembly, some are preparing for fmge exam, some are preparing for the plab exams. Whatever exam you're preparing, just keep preparing, and please before that revise these things. And after that, once you see okay, this, just close your books. Once you revise everything, just close your books, and after the closing your book, just try to recall whatever you, what a glomerulonephritis you studied, first disease you studied, the glomerulonephritis you studied yesterday, whatever you are recalling, are you able to recall that thing? If not, then see again, see the pages again and again and again. Just one or two to three revisions, that is more than enough. So bye bye, good night, see you tomorrow. Bye bye, good night, have a bye bye. Chalo bye, good night, bye bye, Hare Krishna, Radhe Radhe, bye bye, good night. Get out from my Google Meet.